Hello, everybody. Hello, guys. I'm Dr. Urdiales from Spain, and I would like to explain our experience with the new Accent Prime. Sorry for the delay, but we have technical problems here for the communication. Then you know that there are different methods for fat removal. There are minimally invasive and surgical methods, and day by day, the most part of the patients would like to find something to do the treatments, but non-surgical treatments. It must be minimally invasive treatments like laser, light, radiofrequency, ultrasound, cryolipolysis. With these treatments, normally we use at the same time mesotherapy, carboxytherapy, and if you like to obtain better and better results, it's necessary to use any other devices like, for example, liposuction or lipolaser. You know, different companies are developing new products to treat local obesity, and now we are starting to see new ultrasounds with different frequencies, you know, cryolipolysis, for example, and each other treatments in laser-based systems. Now, all of you knows that we have a big experience in the use of radiofrequency since 2004, and we start with this in 2004, and radiofrequency is electromagnetic radiation with different parameters, and now, a few years ago, we are treating all the local obesity with this technology. And there are two kinds of radiofrequency, deep and superficial, as you like. And the most important thing of our radiofrequency is the frequency of emission of the radiofrequency, that this is totally different than the different radiofrequencies that you can find into the market. You know that our radiofrequency emits in a high frequency, 40.8 megahertz, and it means that with this radiofrequency we can get more deep into the tissue. They are developing now new ultrasounds, and since a few years ago, different companies develop different ultrasounds to treat. And I'll explain you what happened with the ultrasounds later. But I can see you now that Accent Prime emits in 60 to 60 kilohertz. It means that with this ultrasound, we are not hitting a lot of the tissue like any other companies are doing with the ultrasounds. However, to do this kind of treatment is necessary, or we prefer to use first of all radiofrequency and later ultrasounds in all the patients, because we think that if we hit the adipocyte before, we can have a better result when we are using ultrasounds. So the effect in these patients is progressive, and you need several sessions. Normally, when we do the sessions between 15 and 21 days, and when we are using ultrasounds in these patients, we are normally using sessions between 15 and 21 days. Hormesis is a theory that when you produce a damage or a stressor into the tissue produces different stimulus that could, for example, at the end produce the head shock protein. The head shock protein is a protein that we produce when we hit the tissue, and this head shock protein is necessary for the collagen formation in all the patients, you know. So this head shock protein is necessary for the collagen synthesis, and with a lot of treatments that we have done in the past years with radiofrequency, is necessary to produce this head shock protein to produce remodelation of the collagen. Okay, we can produce remodelation of the collagen, you know, but it's impossible to sometimes reduce the volume of the fat. For this reason, we now are using radiofrequency for skin tightening, and we are using ultrasound to reduce the fat parts of the body. You know, so the collagen warm-up is necessary for us before all the treatments that we are using later, ultrasounds. don't miss that Accent Prime is the last technology of a big generation of devices that we are using since 2004, and this is the latest. This is the best radio frequency in the market with the best ultrasound, and I explain why. All of you knows that Prime is more like heater. It's a bulky radio frequency. It's light. It's better cooling. It's with more energy, and the device is very easy to use. The device produces radio frequency, unipolar radio frequency. It's a big platform of radio frequency that we can use to ultrasounds. The technology permits to use moving. The technology or stationary is not painful. We can connect different electrodes for that, and I think that now is the most advanced radio frequency and ultrasound platform for fat reduction, for body contouring. What about the cellulitis? You know that we are treating the cellulitis since many years ago with radio frequency, but we had problems with the cellulitis that because radio frequency produces skin tightening in the skin, but never produce a big improvement of reducing of volume into the tissue. For this reason, it's necessary to use radio frequency and ultrasounds. All of you knows what happened with the radio frequency. Radio frequency produce a smooth in the skin of these patients and sometimes reduce the volume. We try always to use ultrasound for diagnosing all the patients because we think that this technology is very useful to control the reduction of the fat mass in the areas that you have local obesity. So I show you later much measurements of the fat in these areas of of the bottoms, for example, on the internal thigh, for example, on the hips, that we can do a measurement of the thickness of this area. So, I think that the most important thing when you are choosing ultrasounds like Prime to treat patients is investigate about which are the expectations of the patients. Normally, we never treat obese patients. For this reason, we treat always the patients that have less than 30 body mass index, and we do a measurement too of the percentage of fat mass, that it must be less than 35% in female and less than 25% in male. We are doing this with Tanita technology. BF180 Tanita is possible to use in all the patients because we can do a measurement of the fat mass. And we are not treating the patients that have more than 10 units of visceral fat because visceral fat produce different metabolic problems in the patients, and obese people are not a good patient, never for aesthetic. So we are using ultrasounds and radio frequency in the patient. We are using Prime in the patients, for example, that are starting to lose weight, and it's necessary to treat these fatty areas that never lose all the fat of these areas only with diet. So we use diets in the fatty people, and we use at the same time ultrasound. We use Prime technology in these patients. We always would like to make a measurement of the fatty deposits with the ultrasound scan because I show you that ultrasound scan is very interesting. First of all, at the first time of the treatment, we use unipolar radio frequency, like I explained before, with the different heads that you can use with Prime, and this is the end point that we obtain with the radio frequency before using ultrasounds. So these are normally the parameters that we are using, for example, in an abdominal protocol. Then we are using 160, 170 watts is unipolar. We held temperatures of the skin between 42 and 44 degrees, and immediately we are using ultrasounds during more or less from 8 to 10 to 12 minutes in all the patients. Sometimes we combine this with mesotherapy, subdermic therapy, vibration therapy, pressure therapy, and lymphatic drainage. It depends about the component of the vascular, of the edema of the patient. It depends that this kind of techniques we can do a combination with these techniques too. So think about that radiofrequency could have side effects. For this reason, it's necessary not to do continuous sessions. It's not my recommendation to do one session weekly. It's necessary to do one session between 15 days or 21 days because we can produce problems in the skin and atrophy of the tissue. So think about that these patients that have pacemakers and have collagenopathies or neuropathies or excessive fatty people are not good for this. So I would like to show you some cases only with radiofrequency that we are doing since many years ago, but now I show you later a lot of cases with the ultrasound device, with the prime device, because here we can control that we obtain results only with radiofrequency. So, which is the principal experience with the accent prime? Think about that. A lot of people in the world would like to reduce of the local fatty areas, and they don't like to use surgery because all of you knows what the advantage of the surgery, and the most part of the people who like to treat, the most part of the people who are losing weight would like to treat these areas with non-aggressive treatment, So if you can see that a lot of people are doing liposuction, the most part of the people don't want to do liposuction and always ask about any other treatments that not be surgical treatment. For this reason, there are much more people that would like to do this kind of treatment. Why? Because surgery is an invasive method. They are feared to anesthesia, and they don't have downtime sometimes to do this kind of surgery. So non-invasive body contouring methods are more safe, are effective, are painless. There are different treatments, and the results, sometimes the patients are very happy with the results. About ultrasounds in medicine, it's a well-known technology that I've been using in medicine since many years ago. But it's very important to understand which kind of ultrasound we are using, because normally ultrasounds produce cavitation into the tissue or produce elevation of the temperature of the tissue. So in a therapeutic ultrasounds, we can find focused ultrasound and non-focused ultrasound, and if we use focused ultrasound, it could be pulse or continuous, or it could be mechanical and thermal, So what we would like to do, we like to do before with the radiofrequency to do a skin tightening of the skin, and to reduce the fat mass of the area, that this is not enough with only the radiofrequency. For this reason, I think that the combination of this, the combination that offers this platform with the two technologies is the best in the market. So, if we look for the old ultrasounds that we are using before, we are using focused ultrasounds like UltraShape. I have been working with UltraShape many years. I have one of them. Liposonic is another technology. These are any other ultrasounds that produce cavitation effect, that this is a mechanical effect, and non-focused ultrasounds, this is the cold mode that accent prime offers, accent prime produces a dual wave action. It's a longitudinal wave and transversal wave, and it produces cavitation and non-increase the temperature of the tissue. Normally, if you are using in continuous mode any other technologies for to increase the temperature of the tissue, like for example liposonic, you are cooking the fat. You are cooking the fat because you increase the temperature of the fat. For this reason, is much more dangerous, and this is very painful for the patient. Take a look about this slide that after and before. I can show you a panoramic echography, and we can see how is the tissue, the fat tissue in a leg, you know, after and before with liposonics. In the right photo, you can see that the tissue decreases, I agree, but you can see a big damage into the tissue, about burns into the tissue, because the patient at the same time have, for example, pain and have, for example, some irregularities in the skin and have problems during 6, 7, 8 months later treatment, you know. So I think that it's not a good idea to use this kind of ultrasounds that produce increase of the heating of the tissue. So accent prime is ultrasound for lipolysis non-invasive and offers to radiofrequency. The technical data, the frequency of the wave is from 60 to 70 kilohertz with high acoustic energy exit is 50 watts with treatment cycles of 20 seconds. Two kinds of waves. So think about that. In this stream, we can see that accent prime have from 60 to 70 kilohertz, and this situation provides that accent produce a minimum increase of the heat of the tissue and maximum activity of the mechanical effect that produce cavitation. So all the devices that have more than 70, 80, 91 megahertz or more produce increase of the temperature of the tissue, and the problem of that is the burns into the body and the painful of the treatment, the pain of the treatment. So we are accent prime is a non-focused ultrasound energy. We can control that because we can to select 3 different possibilities to penetrate more into the tissue. So if we are treating, for example, abdominal area or hips, that is different than if we are treating, for example, the neck, you know. And we have a very good result in all the patients. I show you some cases now. And we protect always skin, vessels, and nerves that always could be damaged with ultrasounds like increase the heating of the tissue, like liposonics, for example. Cavitation is the situation that ultrasound produced in a tissue by a high acoustic energy wave, you know. So cavitation is the production of some bubbles about the action of the ultrasounds into the liquid. Okay, so cavitation is important to produce a damage into the adipocyte, but it must be a cavitation cold, because hot, the cavitation cold produce a damage into the adipocytes. So with the accent prime, we can obtain 2 waves. This is a different of the technology of any other system. We have a longitudinal wave that names cold mode and transversal wave that says hot mode. So longitudinal wave is parallel to wave direction, and transverse wave is the shear wave is perpendicular to wave direction. I mean, this is a hot wave. So it's important that with the combination of these 2 waves, we can obtain any other waves too. With longitudinal waves, the oscillation of the particles occur in the direction of the propagation, So the adipocyte feel that you are doing compressional forces and compressional weights that produce cavitation. And with the transverse shear wave that use accent prime, it's much more easy to damage all the adipocyte that had been damaged before with the longitudinal wave. So this is a combination of two waves that allows to obtain a good result with this technology. So the wave now is totally different than any other devices that you can find to the market at this. So we do with this selective adipolysis because you feel when you are doing the treatment that the principal damage is in the adipocyte. It's because it's not painful and the patient feels the ultrasound. For example, in the thigh, in the mouth, in the thigh, that they feel the ultrasounds. But this is ultrasounds that are producing cavitation, but not are producing increase of the temperature of the tissue. Here, this schematic situation, how works the transverse wave, the longitudinal wave, and the other two waves that you can see that are generation, but the combination of the shear and of the longitudinal wave. One of the very interesting things of the prime is the big grid to apply the ultrasounds. It's a very big applicator, and with this applicator, think about that you can do an abdominal treatment, for example, in 15, 16 minutes maximum, because it's very big and we can treat all the area that this is very easy to treat. How we take the medicines, because it's important to choose the right patient, like before we talked, and we took the medicines in 3 areas. We use the metric to do that and do photographs and treating time. We are doing, for example, in the abdominal area, it depends. This is a small abdominal area. The treatment is for 16 minutes, as if it's bigger abdominal area, and with the hips, it's necessary to use 8 minutes 4 times, And here is the design that we are doing with these patients. And here is how we use the contact gel, the Vaseline, And here is a video how we are doing this treatment. Think about that this patient before has been treated with unipolar radiofrequency. Now we are trying to use only ultrasounds without radiofrequency. But we think that the better result is always when we combine that. Don't miss that radiofrequency produced in these patients, the skin tightening. And the patient feel that the stomach, that the abdominal area is much more empty. Feel that this is more empty. And the skin tightening feels, también, the skin tightening feels, the patient feels a skin tightening in the area. Think about that. If you are more empty, you need to do a skin tightening in all the areas. The treatment is very easy to do, and this is delegable. It's not painful. Only the patient feel the ultrasounds in the mouth, in the thighs, and the patients feel a little elevation of the temperature of the tissue, but very controlled elevation, totally different, for example, like liposonics. I remember that I had an experience before with liposonics many years ago, and we did a couple of patients. Sorry, we did a couple of patients only, and the patients reduced the volume, but they have pain for more than 6 months, 7 months, and they have problems with this. So this is the head movement that we are doing. the head movement normally using in all area. And this is the endpoint that this is similar to the endpoint that we obtain with the radiofrequency. Think about that. This is similar. We see redness, and the patient, when he leaves the clinic, normally feels that something in the area into the stomach that are working. It's probably that the destruction of the fat cells. This is a very interesting work that Josie did many years ago, a couple of years, 3 years ago, and it was done in pig, and we can do the effect of how is the ultrasounds work into the fat, we can see the compression, we can see the lysis here, and we can see more lysis and little inflammation without damaging to the epidermis, and we see some facts about destruction of cells in this area in 3 days, in 7 days. We see some inflammation and different images of the different adipocytes that are damaged only with ultrasounds, with any damage in the blood vessels and in the nerves. So it was the protocol that Josie did at this time, and now we are continuing changing the protocol for this. Now we are starting since 3 months ago with a new study of the action of the results with accent prime, and we are starting to do this. We have just starting to do this with 10 patients. For example, we have the case number 1. It was a woman who age 50, with a weight is 65.8 kilos, with a body mass index about 26. Remember that it's necessary to have less than 30. With a percentage of fat mass about 35.74. Remember that in women it's necessary to have less than 35, 34, This is not always people, because she has less than 26 body mass index, but the most important thing, I think, that this is not the body mass index, this is a percentage of fat mass, because now with the Tanita we can do a measurements about the different areas of the fatty areas, because with the Tanita we can see how much fat you have in your right arm, in your left arm, in your abdominal area, in your thigh, or in your leg. This is different. Take a look about the visceral fat, that this is 7 points only, and in this patient we are doing 2 sessions of accent ultra prime in abdomen, hips, and 1 each 15 days. Ultrasound measurements before and after second session with this protocol, 3 passes of unipolar accent radiofrequency and prime ultrasound in abdominal area and hips, 8 minutes. We are doing now more, but we are doing 10 to 12, but at this patient we did 8 minutes. And this is the reduction average in this patient, even 2 sessions. So in supraumbilical adipose tissue, we reduce 0.65 centimeters, and infraumbilical adipose tissue is 1.1 centimeter. And we can we do these measurements with ultrasound. Ultrasound is a very delicate and very exactly method for to do the measurement at this area. Take a look that, for example, this is the muscle, this is the rectum muscle that you have into the abdominal area, and this is the thickness of the fat that you can find there. Okay, and this is before. This is before, and this is after, that you can see the reduction, for example, here of the tissue, you can see there, okay, you can see the reduction there, okay, and after you can see the reduction in the supraumbilical area, okay, there. This is only 2 sessions in this patient, okay, before and after 2 sessions. All the patients in body contouring treatment, this is very difficult to find, to show photographies, because normally the patients feel that they are more empty in the area of the abdominal area, and the photos You can see the results, but the patient normally feels that have less volume that you can show in the photos. You have after and before. Take a look about the skin tightening, okay? And you have here after and before to take a look about the area of the back here. I can show you these results, for example, before 4 sessions, 4 sessions. Here is much better, 4 sessions and 4 sessions. All the measurements are doing always with ultrasound. Ultrasound here, and the skin tightening is very good here. And take a look at the skin tightening that we obtained, for example, in the back area. Okay. Here another case. I show you only 3 cases in the total. This is a woman who age 59, who have 75.9 kilos. She have a less than 30 body mass index with a percentage of fat mass above 35, visceral fat 9. Normally in this kind of patients, we do a recommendation about to losing weight and do prime treatment at the same time, because the result and the skin tightening is much better in this patient. And take a look about the reduction average, even 2 sessions, that this is in the supraumbilical adipose tissue, 1.1 centimeter, even 2 sessions, and infraumbilical adipose tissue 1.1 centimeter too at the same time. Think about that this patient, for example, I saw this patient this morning here in the clinic. She maintained the weight more or less, but she can use dress like she was weighing less weight, so she feels empty in the abdominal area and in the hips area. Here is the measurements that you can do, and you can see here the measurement. This is a very exactly the measurement, and you can see here the muscle, the rectal muscle, for example. This is before, and this is after. You feel that the skin goes down little, so it's necessary to use radiofrequency continuously in these patients. And the reduction, you see here, the reduction here and here. Think about that this patient, this is a surgical patient. I agree with all the audience that this patient must be do a abdominoplasty, but normally the most part of the patients, 80% of the patients would like to obtain any result with any device, but they don't like to do an abdominoplasty because abdominoplasty is a big surgery, as you know. Okay, so here more, but she's empty in this area like you see here. Okay. Okay, this is the last of the 4th session. Now, normally in a patient like this, I do 8 sessions now, 8 sessions treatment. I saw this patient this morning, and the result is much more improvement. This is another case that we are studying with ultrasounds. This is a woman with age 37. With a weight about 70.8 and body mass index 26.6 is less than 30, with a fat mass less than 26, visceral fat 4. And the reduction average in this patient is supraumbilical adipose tissue, even 2 sessions, 1.3 centimeters, and infraumbilical adipose tissue, 1.8 centimeters. So we do the measurements there. And you can see at the lateral, after and before 2 sessions, after and before 2 sessions is very big improvement result, only with 2 sessions, only with 2 sessions with a very good result, only 2 sessions with a very, very good result. So this patient is not doing diet now because she don't need to lose weight because the percentage of fat mass is right, so she needs to reduce these areas with a non-surgical. But always the key of the result in these patients is the selection of the patient. So I think that we must do a very good selection of the patient, never treat obese people or obese people that don't like to lose weight. It's necessary in obese people to do a diet to lose weight and to do this kind of treatment because the result will be will be very improvement. This is a Tanita device that we used 3-4 years ago. That this is very interesting to do a measurements of the abdominal area, because we can do a measurement about the waist, and we can do the measurement about the percentage of fat mass in this patient. But now we are doing this measurement with this Tanita. That this is this is the better Tanita that you can find now. And we can do all the measurement with that about the liquids, about the percentage of fat mass, about the visceral fat, about the fat that you have in your right arm, in your left arm, in your abdominal area, in the hips, in the internal thigh, all. It's possible to do with that. So I think that in all the patients it's necessary to do this after and before for demonstrate that the reduction of the percentage of fat mass is very improvement in all the patients. I think that it's necessary to explain to the patients that the fat is not eliminated by the urine. The fat is putting into the adipocytes, as you like, and when the adipocyte is broken, the fat go to the circulation, and the fat into the adipocytes is stored about triglycerides. A lot of triglycerides, when the adipocyte is broken, produce glycerol and free fatty acids. Free fatty acids is a combination with the lipoproteins and eliminated by the metabolisms, and only the glycerol is eliminated by the urine, but glycerol is different. It's water soluble. Is water soluble product. So the fatty free acids never eliminate with the urine, are metabolic. So in these patients we do a recommendation to all the patients that we are doing this session, for example, about prime. Is necessary immediately finish the session to do some exercise, to walk 45 minutes, or to go to the gymnastic area or something like this. More than 20 minutes is necessary for that. So I show you some patients that we are doing with prime after and before in abdominal area. It's a very good result. After and before in the abdominal area, it's a very good result. These are the ecography in this patient that we can see in the ultrasound measurements that the reduce of the fat pad is a very improvement after and before. After and before in abdominal area too, with the ecography and the reducing in this patient that you can see in ecography. And this is a very good patient that we did the treatment. It was one of the first patients that we used prime. You see a very good skin tightening and a very good reduction of the fat area. Take a look about the abdominal area. It's a very good patient too. And take a look at the reduction of the abdominal area. I think that in this patient, the result that we obtain with prime is similar like liposuction. For example, it depends about the patient always, but this is a thin patient with a percentage of fat mass that this is not big. And in the back, you can see, and the ecography. Ecography, we think that is important. And this is a very good result too in another patient. Hips, for example, hips is a very good indication for this technology. And abdominal area, for example, here, and the ecography that we are doing this in this patient. Here, the ecography, here, this is another patient, another patient, another patient, here, more, the measurements. And always is necessary, we think, to offer a combination, because we have now the best platform for that. Think about that the rest of the competence devices that we can find don't have nothing about combination of radiofrequency and ultrasound. They are only ultrasound devices. For this reason, we think that we can offer a big platform and with radio frequency we can offer two different possibilities for two different heads for any of the treatment too, you know. So we think that this is an advanced workstation for body contouring and any other indications. I continue telling to all the people who come to the clinic, that to the doctors who come here to learn, that this continue is the best radio frequency in the market, and now I think that this is the best ultrasound device to treat with much more powerful than any other products that we have used. It's important that we are not we don't have disposables for this treatment. It's very interesting because the most part of the ultrasound devices that you can find in the market is necessary to buy a very expensive disposables for each treatment, and this platform allows to do different treatments at the same patient without any problem. And think about that, that the body contouring market, it seems that it's continue growing, because the people who like to do surgery is less year by year, you know, because the technology is offering more and better systems to treat body contouring, you know. And some experts say that in the medical aesthetic industry, it could be the body contour represent in the future 30% of the global market of the aesthetic in 2018. So day by day, year by year, is offering the industry this technology, and we think that it's a very good improvement for Alma to offer this platform. Think about that. If, for example, if in the last in 2016 the top surgical treatments was the second liposuction in women, and in men was liposuction. If we have a lot of people who like liposuction, this is decreasing and increasing all the people who like to do non-surgical treatment, so we can offer this. So thank you for your attention, and now you can ask as you want.
Thank you, Dr. Urdiales. It was very, very interesting. If anybody has a question, you can write on the chat, and we will ask Urdiales. Nadav, you can ask the question.
Hi, Dr. Urdiales. This is Nadav from Alma. Talk about a little bit about the liposonics, and this is very interesting for some of our distributors and partners. Can you mention a little bit about the advantage of the Accent Prime versus the liposonics device?
Yes. Yes, I think that we had an experience with liposonics before, you know, with a couple of patients. I think that it was when liposonics was developed 6-7 years ago or so, 8 years ago, I don't remember. I have one machine in demo here in the clinic. I feel that the heating, I think that it's not a good idea to do a microwave oven heating, you know, to the fat, because I'm agree with you that it's possible that the reduction of the fat is high, you know, but you produce a thermal necrosis of the fat, and it's not a natural situation of the elimination of the fat. So this patient has a big scar inside during several months for this reason, because liposonics don't have a mechanical index for the tissue and have only thermal index to elevate the temperature of the tissue. And you have a scar inside, and the scar is painful, so the patient have dysesthesia or paresthesia or have different problems of the fat that you leave into the tissue.
Okay, thank you very much. One last question regarding the liposonics or even IFU, if we're talking about IFU's devices, because some of them are about body, and some of them are targeting the face. Is it correct to say that the HIFU devices, one of the things that they are missing is the option of treating the same area again and again and again and receiving great results? Because as far as I know, the same as you mentioned, once you are treating an area with the HIFU, you're actually creating a necrosis, and very difficult to treat the same area again, the next treatment. So actually it's good for one treatment, and maybe the next one will not produce any good results.
Normally, patients shows a progress. Normally, this kind of patient shows a progressive treatment, you know. And the HIFU, I think that the market of the HIFU will be closed, because most part of the patient with HIFU presents complications in the following months about pain or about dysesthesia or paresthesia, you know. And they are they are devices that when you are using are very painful to treat that, you know. So I think that the HIFU systems now, for example, that we can find to treat the face and to treat the neck, you know. Here in Spain, they are not. People normally are not happy with that, because normally aging of the skin is to lose fat in the upper and the middle part of the face, you know. And if you use HIFU in these areas, you are increasing the aging of the skin, because you are taking out fatty parts of the face. It's a different situation in the neck, but people have fear to use HIFUs in the neck, and now I think that it's better to use this kind of device with radio frequency. And in the future, in a couple of months, in Europe, it will be developed a new drug from Allergan to treat the neck and reduce the fat of the neck, you know, and you can combine with technologies. But I think that HIFU is not a good idea in 2016 now.
Okay, thank you very much, Doctor. Thank you.
Thank you.